Hi, I'm Paul the Physical Therapist, and welcome to my vlog. Exercise often helps to relieve low back pain. However, there is no one best type of exercise for back pain. That's because not all back pain is the same. An exercise that helps one person may or may not help a different person. A lot of my work as a physical therapist is in determining which exercises work best for the individual that I'm working with at that moment. One type of exercise that does help many people with low back pain is stretching into lumbar extension or bending backwards. Extension exercises often help when low back pain is made worse by prolonged sitting, particularly if a person has pain or stiffness with rising from sitting, or if their low back pain is worse with prolonged bending. Extension exercises also often help people who find that walking makes their low back pain better. In this video, I'm going to discuss and demonstrate my top 5 backward bending exercises. The intent of this video is to demonstrate how I teach my patients to do these exercises. When I have a person to do these exercises, it is a part of an ongoing evaluation of their condition. While these exercises work well for many people with low back pain, they may or may not work well for you. For advice regarding which exercises to do for your back, see your physical therapist. When doing backward bending exercises, it's important to keep your back relaxed during the motion and to go through a full range of motion. Some people with back pain will need to slowly build up to a full range of lumbar extension. In ranking these exercises, I've looked at 2 factors. 1, their effectiveness. How well does one exercise work in comparison to another? 2, how easy or hard is it to do the exercise? For example, a press-up exercise is often effective in relieving low back pain. With proper instruction, a person can keep their back relaxed as they go through a full range of motion. However, this exercise involves a push-up type motion through the arms, and that can be difficult for many people to perform. For that reason, the press-up is my number 2 exercise on this list. Now, many people with low back pain will say that, oh, the press-up is the best exercise for my back, and I'm not discounting that fact. My number 1 exercise is about as effective as the press-up, but it's significantly easier to perform. Okay, so my number 5 backward bending or extension exercise in the treatment of low back pain is the standing backbend. In order to do this exercise, I'll have someone stand with their feet shoulder width apart and place their hands into the small of their back. I'll have them to keep their knees straight. I'll ask them to first tip their head back and then bend backwards fully, and then come on back up again. Now, for some people, tipping the head back like that can be uncomfortable on their neck, or it may make them feel a bit dizzy. When that happens, I'll modify the exercise by having that person to look straight on ahead as they bend backwards, therefore avoiding that backward bending or extension motion of the neck. Some people who have shoulder trouble may find that it's difficult to get their hands all the way behind their back, and in that case, what I'll have them to do is to place one or both hands on their hips as they bend backwards. And the exercise is about as effective one way as the other. I tend to prefer if somebody can put their hands into the small of their back to support their back as they're doing it, but if that's not doable, the exercise can be modified. The biggest pro of this exercise is that it can be done just about anywhere that you can stand and have some space behind you. The biggest con of this exercise is that it's difficult to go through a full range of motion. For many people, the motion is limited by their ability to balance, and they may encounter balance trouble before they reach the end of their range of motion. My number 4 backward bending exercise for relief of low back pain is the Seated Backbend. To do this exercise, I'll have a person to place their hands in behind the head. Typically I'll have the elbows back a little bit, lean back, stretch back as far as they can go, and then come on back up again into a straight up sitting position. To do this exercise, I'll typically have a person sit on a chair with a back that's about this high, and I prefer for that chair to be backed up to a table or a desk that keeps things more stable. When doing this exercise, some people will note that their lower back may lift up from the back of the chair, and that's perfectly good, because that's an indication that the person is going back a little bit farther into backward bending or extension, which is something that we do want to have happen. Some people find that when they get back here all the way, they feel like they could use a little bit more of a stretch. In those instances, I'll have folks to take their hands out from behind the back of their head, let the head go back and reach the arms all the way back. Bring the hands back in behind the head and use the hands to help to return to an upright sitting position. I do like to call that the hallelujah exercise. Now, of course, that is a bit more of a stretch on the upper back as opposed to the lower back. And for some people who do have low back pain, they may also have some upper back stiffness, and that can prove helpful in that regard. A drawback to this exercise, though, is that you won't get really to the end range of backward bending in the lower lumbar spine with it, and for that reason it may not be as effective as some of the upcoming exercises in this list. Some people find that they have difficulty with placing their hands in behind their head when doing this exercise. Sometimes I'll have a person just to use one arm to do this exercise. If, say, they have trouble with one shoulder and can't get that hand all the way back there. Another thing that I'll have people to do is to take a towel, put it into the back of the head. That way you can support the head, but the arms don't have to go back real far. The arms can stay out in front a bit, and simply use that to stretch on back all the way and come on back up. Now, a big plus for this exercise is that it is relatively easy to do. Most people are capable of doing this exercise. Some may need a bit of an accommodation, like using the towel in behind their head. A negative for this exercise is that you may not get all the way back to end range extension, which for many people is the difference between an exercise that maybe kind of helps a little and an exercise that, wow, that really relieved the stiffness in my back, and as a result of my back not being stiff, I now feel some better. The seated back bend, again, my number 4 exercise, backward bending exercise for relief of low back pain. Okay, so my number 3 backward bending exercise for relief of low back pain is the hand rock. To do the hand rock, you start out in an on all fours position. Rock the hips and pelvis forward, keep the head and chest up real high. I have folks to just look straight ahead when they do this. Some folks tend to look up, and I don't really think that proves helpful. Don't think it really adds to the stretch for the lower back, and it makes you tense up some of the upper back muscles a little bit, so I don't think that that's helpful. So, pluses of the hand rock. This is the first exercise in this list where you really can get to the end range of backward bending in the lower back or lumbar spine. And that's a definite plus. And for that reason, it can very well prove to be more effective than some of the other exercises. Now, another plus of this exercise is that some people find that after they stretch bending backwards, they find it helpful to rock back onto the heels and let the back round and stretch the back in the opposite or forward bending direction. So that's one nice thing about this exercise, is that you can alternate directions very, very readily. This exercise does require a degree of strength in the upper body, and for some people that may make them unable to do the exercise. A couple of common mistakes I see people make when they do this exercise is that they will let the elbows bend as they come down, and they will have their shoulders up into their ears. So really with that, you don't end up getting all the way into lumbar extension like you would if you had the elbows straight and you press down through the shoulders to lift the chest and head up real high, lifting those shoulders, or lifting the ears in a sense, up from the shoulders. And, a downside of this exercise is that if you're not quite ready to go through a full range of lumbar extension, when you get into the middle of the range of motion, you end up having to tense up a whole lot in your midsection. So if somebody doesn't have a reasonably good degree of backward bending first, this may not be the best choice for them to start. But if somebody has a good degree of extensibility and just really needs to work at reaching the end of the range, then that can prove quite effective. So the hand rock or the hand heel rock is indeed my number 3 backward bending exercise for relieving low back pain. I believe I mentioned this earlier. My number 2 backward bending exercise in the treatment of low back pain is the press-up. The press-up is really one of the most well-known and commonly recommended exercises for low back pain. When I have somebody to do a press-up, what I really ask them to do is to get their elbows up and over their wrists a bit more, as opposed to keeping the elbows down and into the side. When in doing this, it is a bit more stressful on the shoulders. For example, I don't typically teach people to do push-ups from this position. I typically teach people to do push-ups more with the elbows at the side because, again, that's less stressful on the shoulders. But the purpose of having the elbows up like this is that it does make it a little bit more feasible to really push through the arms to bring yourself up all the way, as opposed to when the elbows are down at your sides. Oftentimes the tendency is to lift from the lower back to make the motion happen, and that tensing of the lower back when somebody's doing a press up oftentimes is the difference between an exercise that's helpful and an exercise that's, well, what I would call unnecessarily painful. Now, for many people who would benefit from exercising into backward bending to relieve their low back pain, they may find that if they try to go all the way into that press-up motion, that back pain limits how far up they can go. And in those cases, oftentimes it's real helpful for folks to just spend a few minutes propped on their elbows in this position, really letting the pelvis and backside and legs relax. The thing that we oftentimes see is somebody who had pain with going all the way up into the press up. After they spend a few minutes in this position, they may find that the press up has become less painful to perform, and they're able to go through a fuller range of motion. Oftentimes, in those cases, I'll have a person repeat this lying prone on elbows on your stomach, propped up onto your forearms. I'll have them to repeat that a few times, because they may find that, each time I do this, the press up gets easier to do. And the goal is to restore a full and free or painless range of lumbar extension. Now, to really get to the end range on the press-up, which is one of the strengths of the press-up exercise, is that it does allow you to go through a full range of motion. It does require some shoulder strength, and because of that, there are some people who simply aren't able to do this exercise. But for folks who can, it's a wonderful exercise. What they can do also is to inhale fully as they press up, locking the elbows out, lifting the head and chest up high, shoulders, the ears not into the shoulders pushed down so that the head and chest again are up real high. And what I was getting at is that if they inhale, as they press up, they can exhale and let the pelvis sag. Don't know how well you can see that, but by exhaling there, I did allow my back to go a little bit farther into that extension motion. Going back to the scenario where somebody's got a lot of back stiffness, they may find that just getting up onto their elbows is uncomfortable. It's a bit too stressful for their back. In those cases, oftentimes I'll have somebody to simply lie flat on their stomach for a few minutes and see after that if they can get onto their elbows comfortably. Okay, so for some people who simply lying on their stomach is uncomfortable on their back, but we think that if we can get their extension motion improved, they may find relief for their back pain. What we can try doing is using a pillow and having that person to lie with the pillow up underneath their pelvis. And what that does is it allows the back to round just a little bit as opposed to being flat. And that can make the difference between lying on the stomach doable and versus it being, excessively painful. The other thing that can be done is you can simply go from lying over the pillow on your stomach again back up into the on the elbows position, and when somebody gets to this level, then a lot of times we're looking at working that pillow out of there and just having them go back to lying flat on their stomach with the expectation that now they'll be able to lie flat on their stomach comfortably to then progress to propping up onto the elbows without the pillow and then onto the press up. The other thing that a pillow can be useful for when doing a press up exercise is if someone's having some shoulder trouble, you can prop the pillow up underneath the chest, and what that does is that starts the person up in a little bit of extension. That can sometimes be useful for if somebody's ready to progress a little bit from just lying on their stomach to going into a little bit of extension as opposed to this much extension. But the other reason I'll put a pillow underneath the chest in doing this exercise is to make that push-up motion a bit easier to do. Because you start off propped up just a little bit and you don't have as big a distance to cover. It's not as much work to do to get all the way to the end of that range of motion. So that's my number 2 exercise for, that's my number 2 backward bending exercise in the treatment of low back pain, the press up. Things that I really like about it are that you can very much get to the end of your range of motion quite effectively. You can grade the exercise. You can start just flat on your stomach with or without a pillow underneath you, propping on the elbows and working into the press up motion. Those are good things. Of course, you have to be in a position where you can lie on your stomach, and that's not always convenient. And the other downside is that some people have difficulty performing the exercise because of limitations in their upper body strength. Okay, so we've arrived at my number 1 backward bending / extension exercise for relief of low back pain, and that is the supported backbend. In order to do the supported backbend, I'll typically tell folks to do this one at the kitchen sink, because you're looking for support that's right about about the height of your tailbone, pelvis, not all the way up into the lower back and not all the way down to the butt. You want it somewhere in between those areas. And to do the exercise, hands on up onto the support that you're using. Relax back into the table as you're standing there. Tip the head back. Keep the feet flat. Keep the knees straight. See how far back you can see. And then push with the arms to come on back up again. There's several things that I like about this exercise. One, it's relatively easy to do. I've had very few people not able to do this exercise, whereas I've had more people not able to do the press up or even the hand heel rock exercise. Another thing that's good about the supported back bend is that as you're going back, you can shift some weight onto your hands, and that can effectively take some weight off of the lower back And for many people, that makes a significant difference in terms of their degree of discomfort with the exercise. Being able to push through the arms a bit as they're going back oftentimes makes the exercise much more comfortable to do. With the supported back bend, you can go back pretty darn far, probably about as far as with any of the other exercises. I have seen a couple of people to simply stand there and lay flat back onto the table and find that that was an effective way for them to stretch. I wouldn't encourage people to stay in that position real long, but sometimes that does help. As with the previous series of exercises where you can go from lying flat on your stomach to on your elbows to bending backwards fully with the press up, with this exercise, if somebody has a significant degree of stiffness with their lower back, they may find themselves just going back part ways and gradually building up to a full range of motion. Similar to the standing back bend, some people, when they tip the head back to go all the way back, will find that that causes them some neck discomfort or some dizziness, and in those cases I tell folks to pick a point straight ahead of you on the wall, keep your eye on it as you go backwards, and then come on back up again. I do like to emphasize to people to really push with the hands to come back up, to not have to strain too much with the trunk. Downside to the exercise, well, you have to have something that you can lean back against. Having something that you can lean back against is the difference, a big difference between the supported back bend and the standing back bend, my number 5 exercise, where having that something you can lean against takes away the balance challenge of the exercise, and you don't need to challenge your balance when you're trying to go through a full range of motion. You want to allow the back to stay relaxed so that you can move fully. Alrighty, so there you have my top 5 backward bending or extension exercises that I find helpful for relieving low back pain. I'm Paul, the physical therapist. If back pain stops you from doing the things that you enjoy, I can help you to get moving better and feeling better. My office, Cedar Hill Physical Therapy, is located in Greensboro, North Carolina. I am available for in-person consultation, and I'm also available through telehealth throughout North Carolina and in select other states. Thanks for watching. We'll see you next time.